This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, and it is definitely a good day in the Delaware Valley, right,
it is.
Dr. Molly?
Well, yeah, I'm sure a lot of our listeners were up late last night, John.
Including yours truly.
Okay.
Okay.
All right, that's all right. And if you were taking your vitamins, your minerals, you're up and out of today.
That's right, that's right. Well, good morning again and welcome to the show, Health Watch, every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We talk about health, of course, and we talk about ways that Dr. Molly and Innovative Medical Associates can help you and your family improve your overall quality of life. And we do that here every Sunday. The number here in the studio, 855-839-1210, 855-839-1210. You can call at any time during the course of the show. And if you want to have a question for Dr. Molly or a medical challenge that you want to run by her, feel free to do that, 855-839-1210. It is definitely a good day, and it's a good day to get healthy.
You got it, John. You got it.
Tell me, before we get into Innovative Medical, in your experience, in your career, what has worked the best as far as what you do with medical challenges? What medical challenge has worked the best for you as far as Innovative Medical is concerned?
You mean in terms of my patients?
Yes,
or
in
terms of our patients?
I
got to tell you, we have such a variety of challenges, that I think in the end, because everybody is such an individual and what it is, their goals, what do they want to accomplish? But I think in an overview of the entire group and what we do, I would say people vehemently say that they really are not looking for a cure in any way. They vehemently oppose the idea of cures. This is my patients. What they want is they want to live a quality of life. And that is so varied, John, because for some people it's about travel. For other people it's about seeing their grandkids or their children, their grown children, being able to play sports with their grown children. For other people it's just enjoying plays and opera and this kind of stuff. So, I think if we as a group, meaning my like-minded healthcare providers as a group, we want to maintain people's health. And by that I mean their health and well-being, their feeling of well-being, and making sure that they're able to accomplish their particular goal. So I really can't say there's one group that I, seen do better than the other, but I can tell you that people who get in earlier than their medical challenge needs to be. Like they get a diagnosis, let's say a year and a half ago, and they only come to see me after they've, used up everything that they could out there and it isn't working for them and they find that their quality of life has really diminished. That is always a big challenge for us. But we manage to help people in that area too.
Well, that's the point, and actually it's the point of the show. So you improve the quality of life by doing what?
Hydration. Hydration is really the cornerstone of what we do. And the utilization of the knowledge of all of our like-minded healthcare providers for the natural substances or the God's ingredients that can augment their traditional treatment or in some cases take the place of. And I have several patients who, had cancer, just did the surgery, and all they want to do is the natural substances at this point. And, it's an individual decision. I have people who have autoimmune the same way. They've done everything. They've done all of the biologics, that kind of thing, and they've decided the side effects weren't for them, and they just want to use the natural substances. So, we really see it all, John.
And so people understand this, like patients like myself, we're on prescription medications.
Of course.
And your hydration.
Absolutely.
So both work.
Sure.
But some don't some choose to not have the
any
prescription
prescriptions,
meds.
right? And again, one of the reasons why many of them choose not to do the prescriptions meds is they failed on so many. That's really the issue. They come to me, they've had like 10 rounds of something, and none of it seemed to work, and they're going to try a different approach. And again, we don't want to put a patient at risk. That's not what we do. I had a situation this weekend where a patient of ours went to the hospital with an extreme high blood pressure situation. And she called me on the phone, and I said, listen, we can't fool around with this, all right? I said, did you by any chance stop your medication? And she said, yes, I did, because my pressure for the last 7 weeks has been great. I said, your pressure's been great with us cutting down your medication, with the good doctor working on this, and the addition of the natural substance. But I said, you cannot stop your medication abruptly. So in she went, and what do you think is going to happen? The doctor now has put her on the full dose of the medication, and we're going to have to go through this again.
Yeah.
And again, we're our worst enemy. We meaning patients, ourselves, human beings, we're our worst enemy, because we start to feel so good. People in my clinic, they go, oh, well, now I can do this without talking about it. And you know what, John? We give patients a lot of opportunity to discuss their treatment plan. I mean, I walk that floor 2, 3, 4 times a day, right?
Yes.
And at that
maybe
point,
more.
maybe more. And I say, what's going on? How we doing? And, invariably they say, oh, well, I forgot to tell you that.
Yeah.
Well, come on now, guys. We gotta do things correctly.
You have always said, never just stop your medication without talking to
The doctor.
the doctor.
Right.
Never stop. And I did that once with a medication.
Oh, I remember.
And man, I'll tell you, after about 2 weeks, whoa, it was really,
Yeah,
it was rough. So I understand that, and I've lived it, so I know not to do that.
Right. And the thing is, I think that, I preach it all the time. I mean, look, you've got to realize that the body becomes accustomed to things, whether they're natural or they're pharmaceutical. And you just don't stop anything abruptly, because we can get something called rebound. And rebound can be worse than the original condition. Come on.
So people can expect, when they come to your clinic and they take the initial consultation,
Sure.
they can expect a full review of
Sure.
what you do and
Sure.
what they do. But then after that, after the initial consultation, what do they expect?
Well, I think that they expect we have to put together a treatment plan directed just to them, utilizing the hydration and the particular constituents of the hydration that will work for their particular challenge, and will work with an understanding of what their particular goals are. Look, John, I'd say right now, we don't cure anything. We can't cure. We can enhance your quality of life.
Yes.
And I would tell you, ask me, what's the big thing? I would say 99% of the patients who walk through that door are disgusted with traditional, because nobody's worried about their quality of life after they leave the facility or the office. They are not worried about that. And they've got to go home to their real life, and they've got to work, or they've got the kids, and they've got all the activities that they do. And they find that what happens is they're not really cared for after that. I can tell you, in our facility, you're cared for.
Oh, and I can attest to that. I mean,
And
you've called me at home several times.
Of course.
After my stroke.
Of course.
And,
Of course.
Every day. It was every day. If you didn't call, I was like, wait a minute, Dr. Molly didn't call.
I got to tell you something else. It's so funny to me. We have a patient who we're sending to a hepatologist. Obviously, we discovered some type of liver issue. I won't go into what it is, but we thought it might be prudent for her to see a hepatologist. And by the way, to get that appointment, to get to the hepatologist from a very well-known organization, it took 4 months.
Oh,
so
boy.
she gets the appointment, and it's due this week. I get an email from her, actually on my phone, a text message, saying, I don't know where I'm going. And I'm thinking, I know Barbara gave her all of everything as to where to go. My other nurse went over it, actually. And I thought to myself, why doesn't she know where she's going? Well, apparently the organization called her, told her she had an appointment. They said to her, we're not sure what office you're going to. Now, they have the appointment. They know they have the appointment, but they didn't do the extra step to say, well, I'm not sure which one of his offices you're going to. Well, we know which office. So Barbara, on Saturday, I called her to go into the chart. She did it, and we telling this patient where to go. But these are the kind of small things that happen every day with the way healthcare is today. And God bless physicians because they're working in it, okay? It's really tough. It's tough.
It definitely is.
Somehow you get lost in the shuffle,
Yes,
John. That's what all I can say.
We are coming up on our first break of the morning. The show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPH.D. Dr. Molly Fantasia is here. She is the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Our number here in the studio, 855-839-1210. And we always tell you, call early so you don't get shut out. 855-839-1210. That's the number. I'm John DeMasi with Dr. Molly Fantasia. We both return. More Health Watch after these words. We are back here on Health Watch, and as always, operators are standing by at Innovative Medical Associates. And the number, 856-489-0505. That's 856-489-0505. And when you call, you want to make the appointment to see Dr. Molly, the initial consultation, of course, and that is complimentary. So that's where you start. And then from there, you can get the information and see where it goes. 856-489-0505. That's the number. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, and she's ready to talk to you at 855-839-1210, 855-839-1210. You always have interesting cases, Dr. Molly, but this one, a throat cancer patient, which is going to lead into the immune system and how important it is. So you want to tell us about that?
Well, I had a young man. He was probably in his 40s. He came to me about a year ago, and he wanted to use our cancer supportive care. And he was diagnosed with throat cancer. Now, he had after reviewing the case, he had a very, very aggressive cancer. And, I really said, I think if you can get the tumor out, you should. He was referred to me, by the way, by a wonderful chiropractor who also told him, listen, after looking at the data that he presented, he thought it was a good idea to at least get the tumors out. So, I tried to encourage him to do that. He didn't want to do it. We actually set up the appointment for him to go to the surgeon. We did everything we could to get him in quickly, and we did. We actually did by, how we put together a chart and calling, etc. My physicians worked hard on the case. I worked hard on the case. The gentleman went to see the surgeon, and he decided the surgery wasn't for him. Well, I cannot tell a patient what to do, but I also said, well, you have to make a decision. Well, I have my own mind. I'm going to do something with herbs and this and that. I said, that's fine. But, I really think we have to do something. You can't do, as I always say, cancer patients can't sit in inertia. All right. So he decided to go somewhere to a nutritional person, and the nutritional person gave him all these, herbals and things like that. Anyway, he calls over the weekend. He calls because he had my cell phone number. Calls over the weekend. He says, you know what? I got to come back because I have fungus in my throat. And I'm thinking, now you got to understand. Now, by the way, I'm out at a holiday party with people who are going to go see the Eagles do a good job. And I'm thinking to myself, well, let me take this call. Let me see what I can do. So I said, well, do you think maybe it's a little more serious than that? No, I'm sure I'm cancer-free. They just can't tell because I have so much of this fungus and this thrush in my throat, and I thought you might be able to help us with that. And I said, well, why don't you come in and bring me all your data? And he said, oh, you have it. I said, you don't have any data from the time you left me to now? No, I didn't want to see any real doctors. I said, well, I want to tell you a little story, my friend. I said, first, I want to tell you that every doctor in my place is a real doctor. Okay, let's start with that. Every nurse in my place is a real nurse, all right? So I was a little bit, I said, now, here's the thing. I said, come on in. Let me see what we can do. In my mind's eye, I believe that the thrush is just a symptom of how severe the cancer is. I asked him, are you having any trouble swallowing, eating? Oh, yes, to everything. Well, I got to tell you, John, I certainly am going to try to help the boy, but I am really disappointed because here's a case, clearly, that we did the best we could to encourage him to get conventional care and still use us to maintain his quality through the conventional care. But he didn't want to do it. And so, I'm faced, and he didn't want to come back to me. That was the thing. Once I suggested doing the conventional care and set it all up, he was done. He didn't want to do it. And I'll work with you no matter what. And I think even if he didn't want to do the conventional care, had he kept up some of what we were doing, he'd be in better shape than he is now.
Well, you always say when you need the surgery, when the surgery is necessary, get it.
Right.
And then you and your staff will work with
getting
the
you
patient
through whatever course of treatment you want to do after that, and we'll also help you improve post the surgery to improve your quality of life, to get you back on your feet right away, to help heal. So I was disappointed, but of course I won't say no to someone in need, John.
No, but the point of this story is, you could have helped him.
I think more than what I did, and that's the point.
Long ago.
I think we could have helped him more than what we had the opportunity to do. The point of the story is we will meet a patient where they are, but in the best case scenario, if we can help a patient get a conventional treatment like the surgery and then aid them in the recovery from the surgery and whatever else needs to be done, and they don't have to do conventional, but aid them in improving their quality of life. That's what we're all about.
Well, that's really
that's
the
the
playbook.
Crux of it.
That's it.
That's it.
Okay. What does it say about the immune system and the integrity of the immune system?
Well, the integrity of the immune system, I want to say, is so important because it's our immune system, and you've heard me say this a million times, that actually neutralizes the invaders that invade our body, right? Here's the problem with the immune system. It is a delicate balance, and you need to have the Goldilocks theory no matter what you do, because the difficulty is when the immune system can't differentiate between a self-substance, meaning our own cells, right, and an invader or a dysregulation, identifying the dysregulation that's going on within the immune system and the lymphatic system. This is a big problem, and we can help people with this. Another story. I had a story this week. I have a wonderful young woman. She's only in her late 30s. She had Kawasaki disease when she was a baby. Sounds like a big thing, and it is. It is. It means that they have high fevers. They don't feel what. This is when you're like first born. It can happen like in months when you come around, but it is an autoimmune disease, and it tends to resolve in childhood or adolescence, but she had Kawasaki disease, and I didn't know it because on her paperwork, she never filled it out because she doesn't even think about it. But we noticed that she's having additional autoimmune disorder in the skin. Now, Kawasaki really affects the vascular system, but I started to think about the overlap there. But the story is she came into me and she was worried about her hair, not the hair follicles. Yes, she had the skin pain in the mucous membranes, this kind of thing, but she was really more worried about her hair. So she did come and we were putting together a course of hydration therapy that included some B vitamins. It included some additional substances. You know, I like to use subclinical doses of pharmaceutical if need be. And I really wasn't sure. She tested negative for any of the autoimmune that would ultimately look at college dysregulation, that kind of thing. But you can be sure she had a subset of that.
Yes.
Otherwise, she wouldn't be having the problems. Anyway, while she was out, she saw a TV commercial for a brand new product that was going to help her hair. So she orders like 10 bottles of this, and she comes in and she's been taking it, unbeknownst to me, for like 3 weeks. And she said, Dr. Molly, I'm feeling terrible, and she's telling my nurses. And well, here, I said, well, do you have the product? Well, no, I'll bring it in next time. So I'm looking at it. She clearly is taking a particular herb that doesn't actually work for her and actually is causing the immune system to work against her. So any of the progress we made, she said, I was feeling so good. And I said, could you do me a favor and stop that herbal remedy? And she said, oh, yeah. I said, how many times do I hear this from patients? You know, John,
yes, I
we
know.
will take time and go over all of your supplements, all of your herbals, and then we will tell you which ones maybe to take, which ones to throw out, even though you brought in 5 shopping bags of them. And we will help you actually hone it down and identify maybe the culprit that's causing the problem.
We can repeat that story with many of your patients.
Yes.
Me included. So
I know.
We'll pick that up after the break. We are coming up on the halfway point of the show. Boy, time flies when you're having fun. It's the halfway point. Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly is here, and she is ready to talk to you at 855-839-1210. 855-839-1210. The program is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. We will come back with more of today's edition of Health Watch right after these words. Welcome back to Health Watch. Operators standing by right now at Innovative Medical Associates. 856-489-0505. That's the number. 856-489-0505. If you call there and you want to make the appointment with Dr. Molly, feel free to do so. The initial consultation is complimentary, and you will learn a lot from that. 856-489-0505 is the number. And you'll also learn a lot if you go on the website, innovativemedicalassociates.com. innovativemedicalassociates.com. You'll really see a lot of information there, so you can check that out as well. innovativemedicalassociates.com is the website. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. 855-839-1210 is our number here in the studio, 855-839-1210. We want to pick up that story, Dr. Molly. It was really interesting. My point, John, is that Goldilocks is not just a fairy tale. Things have to be done just right in order for our integrity of the immune system to work in an optimal level. And so I want to tell people, it's in the quest to promote or boost your immune system, you should proceed with caution. This is why herbal preparations, supplements, essential oils, and pharmaceuticals, there is a downside to everything. You want to utilize whatever you're doing with the help of someone who knows their way around this. And that's why it's so important. And it's not just important in terms of the quality of the products you're using outside the facility or outside of Innovative, but it's important because the potency of some of these products can be detrimental to you. And more is not always better. You've heard me say this. And sometimes, and it's the synergies of some of these products. Together, they can put together a lethal kind of dose for your immune system, I'm talking about, not to kill you. Believe me, I love natural products. I love God's ingredients. But it's a good idea
to make sure that when you come in to see us and when you are on a particular protocol, that we re-engage and talk about anything new you bring into that protocol.
Yes.
So this has been the past several weeks we have run into this, because people start to feel so good that they think, oh, you know what, I can enhance this. I saw this on TV, as seen on TV.
Yeah.
Well, listen,
Doesn't mean it's good.
Yeah, right. I think that we really need to look at a lot of things when we talk about our immune system. For example, I had another patient just this past week who is a runner. I think I've spoken about him before.
Yes.
And we actually fixed up his knee, and we did this with our regenerative medicine protocol. Well, he said, guess what I'm going to do? Now, he's about 6 months out from when we started with his program. I'm going to go and run this marathon or this triathlon. I said, whoa, wait a minute. I said, we had to wait until 7 months to repeat our MRI. He goes, I can tell I'm perfect. I'm this, I'm that. I said, please let me run. Let's run an additional MRI. Fortunately, his MRI showed a complete heal of the tear. But here's the thing, guys. Just because you're feeling this great, don't go out there and start to be your own healthcare provider.
We'll pick that up in just a moment. But first, we're going to go to the phones. John is in Bucks County. Good morning, John.
Hi, John.
Welcome to Health Watch. You're on with Dr. Molly.
Hi, John.
Hi, good morning, Dr. Molly. I know I met you before. I'm the pharmacist that got you help my back. So I always like to call every once in a while when I have time, especially on a Sunday. I love hearing you guys. Got a question.
Sure.
My mom, we had to put her in a memory care place. And it was heartbreaking. She lived with me, I think I told you, for over 3 years.
Yeah.
She's doing great.
Good.
But I get concerned because now she's not in my care.
Right.
I'm trying to look at some type of modality to really help her stay healthy. And I was looking into glutathione IV,
Absolutely.
Keeping her detoxified, helping that cognitive function. And I was like, you know what, let me give her a call and see what her opinion is if I did it once a month. Because the problem is taking her out of there, which I can, but it's a little bit harder when she's not living with you.
Of course,
So just wondered your opinion on that and, see what you think.
I'll tell you what, John, I absolutely agree with you. I think the glutathione would be absolutely great because you really do need to do the detoxification. I think also we might look at a few other things as well. I mean, if you can get her out, it would be a privilege for me to treat her. I just have so much respect for the work you do. I mean that sincerely, and
feelings mutual, by the way.
Yeah, we would take care of her very well. I think she might do well too with a little bit of vitamin C therapy. Certainly, I would want to look at the methylated B vitamins for her. Look, we're not going to bring her back to when she was your darling mother at 40, right? But if we could give her a little relief from this, I think it would be worthwhile. It's funny you called today because I attended a funeral this week of a patient of mine who was 91. And he had memory problems. He was a very big shot attorney in Philadelphia, and his firm is still going on. His family's running it. And he was a wonderful, wonderful guy. He came to me for many, many years. In the last 3 months, they had to place him in the memory care. And imagine that he was with me into his 90s, utilizing just what you're talking about, glutathione, some of the vitamin and minerals that we are talking about, and 3 months of an issue. I think for us that's a win, and I think I need
to tell you one last thing. I want to tell you last thing. I don't mean to cut you off because I know my time's limited here.
No worry.
I need to get you over there with your facility because I keep telling the people there, and I told my kids, I brought them over there, and I was like, you're going to see some people that look really out of it because they're probably on tons of meds.
Right.
I said to the one person there, I need to get IV hydration to all these people. And I thought of you when I said that. I was like, man, I need to get Dr. Molly, just come over there and just boost these people because they look like they're dead, some of them. It's a shame.
Hey, I think we could do something like that, John.
Yeah.
I really mean that.
That would
and
be
I
good.
think it would be a great thing because, it's a question of guys like you who are pharmacists, who know this kind of thing, and compounding pharmacists, helping me educate physicians that this is something that can be done and done easily and done right. It's not just spa-like. I'm with you,
Yep.
John. God bless you.
Thank you. I'm going to give you a
and
call.
your
I'm going to
work.
give you a call
Thank
this
you.
week.
Thanks for the call.
Thank you,
And-
my
and
friend.
Good luck
Thank
with
you.
that.
That's
Okay.
a very interesting call, and he is, because I am so hepped up about this, John. I see all of these places opening up, indiscriminate use of glutathione, indiscriminate use of the vitamin C, the wrong forms of the vitamin C for patients. And I see it all. I see it all. And, I had a physician stop in to see me this past week. She's a GYN. She brings me a brochure of a new kind of facility that opened up, quote unquote. Not a facility. It's not licensed, nothing. She says, look at this, Dr. Molly. She said, now I'm going to send my patients there for an infusion to this place when they have something called your overnight detox from drinking. I mean, it was really there. Your post-drinking IV, your post-workout IV that includes no amino acids. I said, well, there are standard protocols out there, but I will tell you that when you look at specific types of conditions and you look at the patient, meet the patient where they are, we can get some things done.
You were talking about the natural substances.
Sure.
And, just because it's natural, it doesn't mean
Hey,
that it's
good
that's right.
for you. It doesn't mean it's good, period.
Remember the
I remember.
So I'm walking around at this convention, and the guy says to me, "Hey, take here. These pills are free. Take it, and you know what? You're gonna have sex for 2 days."
Yeah, I know.
Yeah,
You're
that's
going.
what he said.
That's right. That's right.
So I showed it, and I knew not to take it.
I know
but
you
I
did.
showed it to you, and you said, "Well, you would have not only had sex for 2 days, you wouldn't have had sex anymore
Right.
because
you
would
might have had
been-
those 2 days, but you weren't going to be around much
You would have
longer.
been dead."
Right, exactly. But
That's
it's
the
interesting,
ingredients that
the
we're in.
ingredients that are in some things. And as look, I have physician patients, you know that.
Yeah.
And it's because we take the time to develop our protocols and to utilize. You can't just take everything and throw it against the wall and say, hey, this is your protocol. You want to use things that work for a particular patient at a particular period of time.
I was going to ask you, but I know the answer, so I'll ask it this way. I was going to say, does this work? But I know it works. How does it work? And can you expect when people do it your way and follow your protocols, can they get results?
Yes. The short answer is yes. Yes, and you can see the results in your quality of life. Are you feeling more energy? Do you feel like you're a little quicker on the uptake? Did you have a stroke? Are you post-stroke? And do you feel that your memory is coming back? Do you feel like your overall focus is back? Those are the kind of things. Qualitatively, we have a chart we can help you with. That's true for our cancer patients. I mean, our particular cancer supportive, I would say, record for the patient is very thick. I don't know if you've ever seen it. It's like 10 pages long that they have to sit and fill out before I start them. And the reason being, it's a true integrative type of record. I want to know what you're taking during this. I want to know what the chemo is if you're taking it, what the radiation is, and I want to see whatever the biopsies were and where they sent out to look at the actual genetics of the tumor. So this is a pretty extensive thing. And does it work? Because you're feeling better. You're having less of the side effects from the chemo. And we're not causing the chemo to be ineffective because we don't want to use antioxidants that do away with the free radicals that they're creating to kill the cancer. So there are so many things here, John. Yes, short answer is it does work.
We are coming up on our final break of the morning, which means we still have time to take one or two calls quickly. 855-839-1210 is the number here in the studio. 855-839-1210. The program is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. I'm John DeMasi with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We both come back. Dr. Molly and I return after these words. Welcome back to Health Watch. Operators are standing by right now at Innovative Medical Associates, and the number is 856-489-0505. 856-489-0505. That's the number. Call and schedule your initial appointment with Dr. Molly. It is complimentary, but you'll really learn a lot with that, so check it out, 856-489-0505. And remember, the website, innovativemedicalassociates.com. InnovativeMedicalAssociates.com is the website. And we want to remind you, in case you missed our show or you missed some of it or you want to hear it all over again, you can hear it this afternoon. It's our Health Watch replay from 4 until 5 here on Talk Radio 1210 WPHT. And this is our live version of Health Watch, 856. Oh, that's your number.
That's right.
855-839-1210 is the number here, 855-839-1210. We want to talk to one of our favorite callers, Joe in Mount Airy. Joe, good morning. You're on with Dr. Molly.
Hey, Joe. How you
Good
doing,
morning,
my
Dr.
friend?
Molly. Good
How
morning,
you doing?
John. I'm doing well. Thanks for asking. I know y'all pressed with time, so I'll make it real quick. You know, I was so happy I had a chance to talk to a nurse practitioner at one of the more prominent medical centers over here in the Philadelphia area the other day.
Okay.
And when I went for the appointment, she told me, she was honest. She said, Joe, I did get the vaccine, me and my husband, my children, and we got the boosters, and we still got COVID. She said, but however, she said, Joe, I'm open-minded. She said, you know, she said, Joe, I know you didn't get the vaccine. You took ivermectin and all them other things. You didn't get it. She said, I think if this medical profession was fair, they should have studies for people like you who didn't get the jab and took ivermectin and other things and didn't get it, so they're just shutting people down. She said, people want to get the vaccine, that's their choice, but she said they should have an open-minded study and say, well, the people that didn't get it and took ivermectin and vitamin C and zinc and everything and didn't get it, she said they should be applauded and they should be studied as well. You know, she said instead of just shutting people down, because that's what most of them do. You bring up ivermectin or any other thing else, they shut you totally down, and it's so wrong and stuff, Dr. Molly. And lastly, Dr. Molly, I recommend that you and John see two documentaries called Die Suddenly and Anecdotal. You must see those, because and I close with this, Dr. Molly, because I know you press for time. You can't explain why young people around this country, the media, the mainstream media is blacking this out. They have no prior health issues. They dropping dead after they got the vaccine. Young people that was healthy, athletic age, everything, didn't smoke or drink, and just dropping dead after getting the vaccine, having all kind of cardiac problems. That's no accident. So I just want to share that with you and John. Thanks, Dr. Molly.
God bless you.
Thanks a lot, Joe.
Hey, Joe.
He says a lot in a few
does.
minutes.
He does. Hey, but isn't this interesting? Because Joe made a valid point. See, the problem is, in traditional medicine and in traditional science, which I come from, we love double-blind studies. And we don't look at anecdotal studies. So when you ask me, does this work? I can give you some of the analytics, but I can't equate that to a double-blind study. And I had this discussion with a physician who referred his patient to me for vitamin C therapy. In other words, I'm not going to tell you what else I use in there because I would like to actually publish about it. He goes, well, you'll never be able to publish about it, Dr. Molly. I said, well, I might be able to in the integrative world.
Yes.
Because here's the thing. If we see anecdotally the patient has improved and maybe the norm for a particular problem, including this virus, is 8 years, 9 years, and our patient is able to go for 12 years without a relapse, maybe that's a win, right?
Yes.
And he isn't down for the count during these 12 years.
Yes.
So Joe makes a valid point. Why aren't we looking at more anecdotal studies, whether it's about the virus or cancer or autoimmune, in everything we do? They do it in Europe. We just don't do it here in our country.
Okay, 855-839-1210. We've got a couple of minutes left of the show. what did you want to say about the
glutathione that
Yeah.
John was talking about?
Yes.
Yes, glutathione is a great detoxer. It's very important for the liver. It's an interesting thing. It's also important for the brain because, our gut on our brain, little brain is what we call it. Bottom line is this: we're using it for our post-COVID patients in both the IV form and in a nebulizer form. Now, this is where our compounding pharmacist comes in so clearly because there's a different melting point. These are the things you think about all the time. There's a melting point when you use a nebulizer. You're vaporizing something. So the melting point has to be very well researched and developed. And when I pull that glutathione out of our particular room that we mix in, we want to make sure that there's a melting point on that and we know what it is and we're comfortable. This is why our compounding pharmacist is so important to a clinic like ours and why I have contracts with them.
Do you use glutathione often?
Yes, I use it often. It's in many protocols, various forms, reduced glutathione that we use. We also use things to enhance the action of glutathione. There are other nutraceuticals and cofactors that can do this. And I would tell you that our post-COVID patient who we did the regenerative medicine on in this past couple of months, Tim, is doing so well. He actually drove me around an hour and a half last week when I didn't feel like driving. And I certainly appreciate all his work with us, his volunteer work with us. And as a result, he's doing really well. So, yes, the short answer is yes, we use glutathione. Yes, we use it both IV. We use it in various other ways. And I would tell people it's a very important amino acid.
In what cases or in what situations does it work best?
I would say it works well for many things, not what works best. It's what works best for you.
Yes.
What are we trying to accomplish? So we use it, of course, as John said, for the detox, in particular for the brain detox. We use it in the cancer patients, in certain cancer patients. We use it for various viruses, for hepatitis, in fact, people who've had post-hepatitis. And again, we'll use it just plain in the detox from some pharmaceuticals that have damaged the liver, etc. So there are many ways we utilize many substances. The idea is you want to use them properly for a particular patient, for a particular problem, in a particular protocol.
And that's where
expertise comes in.
Expertise
Yes.
comes in, right.
Absolutely.
Because you don't want to just use it
We don't
anywhere.
look, we're not going to throw everything against the wall and say, hey, this is what we're going to do for you. We also want to use it synergistically with other substances. That's the key to everything, John.
Well, looking at the clock, that's going to put the wraps on another edition of Health Watch. Don't forget, Dr. Molly is available during the week at 856. In fact, you can call the operators right now or call them after 9 o'clock. They'll be there. 856-489-0505. That is the number. And you schedule your appointment, your initial consultation. It is complimentary. 856-489-0505. The website, innovativemedicalassociates.com. innovativemedicalassociates.com. And don't forget, if you missed any of today's show, you can catch us this afternoon, 4 to 5, right here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical, the lovely Linda, and our nursing staff, Barbara, Lana, Catherine, and we have a new addition, Donna. And then there is Delightful D, Fabulous Fran, Joanne, and our nursing assistants, Kathy, and we welcome Sandra to the nursing assistant staff. Those are all the people. It's getting bigger. That's going to do it for another edition of Health Watch. I'm your host, John DeMasi. Thanks for listening. We'll talk to you next Sunday, 8 till 9. Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.